What are irregular period symptoms and solutions? Part 2. What is irregular periods? Causes of irregular periods, reasons for irregular periods. Irregular periods causes may be organic disease or dysfunction. Many systemic diseases such as blood disorders, Glanzmann's disease, hypertension, endocrine disorders, miscarriage, ectopic pregnancy, mole, hyperprolactinemia, cancer, such as ovarian cancer, uterine fibroids, breast adenosis, tuberculosis, tubal tuberculosis, endometrial tuberculosis, inflammation, chronic endometritis, chronic tubal ovarian inflammation, can cause irregular menstruation. Irregular period symptoms. Heavy menstrual bleeding, menstrual scarce, menstrual disorders, uterus bleeding, lower abdomen pain, early menstruation, menstruation delayed, menstrual cycle changes, physiological amenorrhea. 1. The menstrual cycle change. 2. Menstrual abdominal pain, fall. 3. Menstruation postponed. 4. Early menstruation. 5. Before and after the menstrual abdominal pain, fall. 6. Secondary amenorrhea. 7. Menstrual swelling. 8. Age at menopause prematurely. 9. Menstrual volume big. 10. Excessive menstrual blood clots. Irregular periods diagnosis. 1. Menstrual scarce. Menstrual blood less than 10 milliliters or less, 2 layers of paper can't be wet through, 1 period or more. 2. Menstrual cycle changes. Menstrual cycle times long, more than 7 days. 3. Menorrhagia. Several consecutive menstrual cycles. Menstrual bleeding volume big, but menstrual bleeding time and interval time all normal, no intermenstrual bleeding, bleeding after sexual intercourse, or blood sudden increase, belong to ovulatory dysfunctional uterine bleeding class. 4. Children menorrhagia include several meanings: bleeding too much and too long, more than 7 days, menstrual frequent, less than 20 days, also called polymenorrhea, frequent bleeding or irregular menstruation or with heavy menstrual bleeding, menometrorrhagia, which are mostly an ovulatory dysfunctional uterine bleeding disease. If you continue to suffer from the above, it is irregular periods. Should be careful, because irregular periods usually cause infertility. In preparation for pregnancy, it is best to cure irregular periods fast, to ensure progress of pregnancy smooth. Performance of the menstrual cycle or bleeding disorders. Irregular bleeding, including menorrhagia or duration too long, happens when patients have uterine fibroids, endometrial polyps, endometrial hyperplasia, endometriosis, periods volume and frequency less than normal, menstrual period cycle less than 25 days. Occur more often, or prolonged menstrual cycle interval, longer than 35 days, irregular bleeding, caused by a variety of reasons. Irregular bleeding can occur for different reasons, endocrine causes or systemic disease causes. Dysfunctional uterine bleeding. External genitalia without obvious organic disease. Uterine endocrine system disorders caused irregular bleeding. One kind of menstrual disorders, the most common kind, happens in puberty and menopause, can be divided into ovulation and anovulatory. Two kinds. About 85% of cases are anovulatory dysfunctional uterine bleeding. Vaginal bleeding after menopause. After menstruation stops 6 months, bleeding, often caused by cancer, inflammation. Amenorrhea. Amenorrhea refers never have periods, or the menstrual cycle has been established and then stop 3 more cycles. The former primary amenorrhea, the latter for secondary amenorrhea. How to stop irregular periods. How to stop period cramps, dysmenorrhea. 1. Although a healthy diet, a balanced diet cannot eliminate the pain thoroughly, it is magic to improve the health of the body. Avoid junk food which is too sweet or salty, they make you flatulent and slow. Eat more vegetables, fruits, chicken, fish, and try smaller meals but more times. 2. Supplement minerals, like calcium, potassium and magnesium. Minerals can help relieve menstrual pain, period cramps. Experts found that women taking calcium, compared with those who did not take, have less menstrual pain. Magnesium is also important because it helps the body absorb calcium efficiently. Before or during menstruation, intake more calcium and magnesium. 3. Avoid caffeine. Coffee, tea, cola, chocolate contains caffeine, makes you nervous, discomfort during menstruation. Therefore, you should avoid caffeine. In addition, coffee contains oils may stimulate the small intestine also. 4. Prohibition wine. If you have edema during menstruation, alcohol will aggravate this problem. Do not drink. If you can't hold, limit between a 2 to 1 glass of wine. 5. Do not use diuretics. Many women believe that diuretics can reduce swelling and discomfort of menstruation, but Mubarak physicians oppose this approach. Diuretics will excrete minerals, along with water. Mubarak doctor suggested, reducing the intake of salt and alcohol and other substances causes water retention in the body. 6. To stay warm. To keep the body warm will accelerate blood circulation and relax your muscles, especially spasm and congestion in the pelvic area. Drink hot herbal tea or hot lemon juice. Can also be placed a heating pad or hot water bottle on the abdomen for a few minutes every time. 7. Mineral bath. Soaks in warm water with 1 cup of sea salt and a cup of sodium bicarbonate in the tank. Soak 20 minutes, helps relax muscles and ease period cramps, menstrual pain. 8. Sports, especially before menstrual, walking or other moderate exercises, will make you more comfortable during menstruation. 9. Yoga exercise can relieve period cramps. For examples, knees bent down, sitting on the heel. Forehead touched to the ground, arms straight, stretch at the sides of the body. Maintain this position until feel uncomfortable. 10. Taking painkillers. Aspirin and acetaminophen can relieve period cramps, menstrual pain. However, more effective medicines, including Advil, Holtrin, Mediprin, and Nuprin. These drugs containing ibuprofen can inhibit the role of prostaglandins. At the beginning of period cramps, menstrual pain, take together with a little milk or food, so as not to hurt the stomach, and continued to take to the menstrual pain disappear. 11. Other solutions. Acupressure. The foot contains some acupressure points are considered connected with the pelvic region of the gas path. Bilateral ankle depression. There are acupressure points. After gently pinch it with thumb and other fingers, along the Achilles tendon, until the calf. From right to left foot, a few minutes each time. Subscribe our channel for future videos. Visit our website holisticmeaning.com for more informative articles.